Senate and Professor Minagwaho, dear Africa CDC Chief Science Advisor, Dr. Nikes Dembi, members of the Conference on Public Health in Africa Scientific and Organizing Committee here present, members of the press joining us in person and virtually, distinguished ladies and gentlemen, all protocols observed, good morning. And welcome to the official launch of the second International Conference on Public Health in Africa, due to take place in Rwanda from 13th to 15th December this year. My name is Julien Niyingabira, and I am pleased to be your host throughout the event. Honorable Minister, distinguished ladies and gentlemen, allow me to quickly present Rwanda Biomedical Center, a national health implementation agency in Rwanda. She previously worked as a division manager of research, innovation, and data science at RBC. She has also served as a precision medicine fellow at the World Economic Forum. She has previously worked as a consultant for WHO and USAID funded projects in Rwanda and Guinea-Conakry in the post-Ebola recovery period. Please let's join our hands as we receive her on the stage. The floor is yours, Mrs. Noela.
So I guess I'll keep my mask on. Huh? We are safe so far, but you may use these microphones later. Maybe it's a reminder that we're in the midst of a pandemic. So what do we want to do, moderator? Do we want to keep them or remove them? Okay. Thank you very much, and good morning to you all. It is a conference on public health in Africa. So as we heard, this will be the second edition of the conference, but it will be the very first edition that is held in person. And so this conference will be hosted by the Rwanda Ministry of Health and will take place here in Rwanda, in Kigali, in December of 2022. And we'll have throughout the day an opportunity to get more information on this conference. But it's really a unique platform for African leaders, for researchers, policymakers, community members, and other stakeholders to...
...of 1.3 billion people. I think it's quite fascinating that this is a unique platform to really provide that unique environment. It is with great excitement that the Africa Centers for Disease Control really announces this second annual International Conference on Public Health in Africa, which will take really place in Kigali. We have slightly tweaked within less than an hour the theme of this conference to really reflect the current situation, which is preparedness for future pandemic, Africa at the crossroads, which is definitely going to offer that unique platform that I mentioned for African leaders, researchers, policymakers, and all stakeholders to share scientific findings and public health perspective and collaborate on research, innovation, and public health across the continent. This second edition will really meet the expectations for the Future Africa CDC mission, which is about strengthening Africa public health institutions, capacities, capabilities, and partnerships to prevent, detect, and respond quickly and effectively to disease threat based on science, evidence-based policy, and data-driven intervention and programs. This is an abstract or scientific-driven conference where we're going to share content, real-life data with all our delegates. We'll also look ahead and discuss how to come together to establish a new public health order and build a more resilient Africa. So it's clear that we must urgently elevate the innovative research coming out of Africa, and that's exactly what will happen during this CPHIA 2022. We're going to co-create that with the local organizing committee and with our able co-chairs, Prof. Agnes and Prof. Senite, to be sure that we meet the expectations of our delegate. With that, thank you so much for your hospitality in Rwanda and Kigali. Thank you.
Thank you so much, Dr. Nikes, for your remarks. And thank you for reminding the public that Dr. Johnson Hekasong will not be online and be replaced by Dr. Uma. Our next two speakers are the co-chairs of this conference on public health in Africa, respectively Professor Senait Fiseha and Professor Agnes Binagwaho. Professor Senait is a globally recognized leader in reproductive health and rights and a lifelong gender champion. She currently serves as the director of global programs at the Susan Thompson Buffett Foundation, as well as adjunct faculty at the University of Michigan School of Medicine. She's a co-chair of the International Conference on the Public Health in Africa, CPHIA 2021 and 2022. Professor Binagwaho is a global health deputy leader who formerly worked as the Minister of Health and a permanent secretary at the Ministry of Health of Rwanda. She's the co-founder and vice chancellor of the University of Global Health Equity, UGHE, and she's co-chair of the International Conference Public Health in Africa, CPHIA, and CPHIA 2022. Let's please request you to join our hands as we receive Professor Binagwaho to speak and deliver his remarks.
Merci Julien. Je vais parler en français parce que l'Afrique est divisée. Hein? Ce n'est pas de notre faute, c'est l'histoire. Et cette conférence concerne toute l'Afrique. Honorable ministre de la Santé, Dr Daniel Ngamije, ma chère coprésidente de CPHIA 2021, donc 2021 et 2022. Le directeur de Afrique CDC, qui est très bien représenté ici, le député directeur de CDC, Dr Ahmed, que nous allons entendre bientôt, le conseiller scientifique en chef de CDC Afrique, Dr Nikes, les membres des comités scientifiques qui ont déjà été sélectionnés, le comité est déjà formé, de scientifiques rwandais et de scientifiques de toute l'Afrique, Afrique francophone, Afrique lusophone, Afrique arabophone, les délégués d'Afrique CDC et aussi mais alors je dois aller en arrière, hein? Et puis l'estrade doit me suivre. Non, merci, j'ai assez de micros comme ça. Alors, et les membres de la presse, bien sûr, mais avant ça aussi, les membres de l'équipe locale qui ont déjà fait beaucoup pour préparer le succès de cette conférence à venir. Bonjour à tous. Et c'est avec plaisir que je me tiens ici devant vous à l'inauguration, au lancement de la conférence qui aura lieu en décembre de cette année et qui sera la deuxième conférence internationale sur la santé publique en Afrique. C'est très important. La première conférence a eu lieu virtuellement et a été un grand succès, avec 12 000 personnes. Et l'Afrique a compris, sous le leadership de l'African Union, représenté par CPHIA, qu'une telle conférence est clé pour des échanges, pour démontrer ce que l'Afrique a fait. On va toujours à Paris, New York, Londres, pour montrer les choses que l'on fait en Afrique, qu'on le montre en Afrique. Et ça nous permet d'éduquer beaucoup plus d'Africains et de montrer comment l'Afrique doit et est en chemin pour avoir des secteurs de santé résilients, pour être préparés, comme le thème de cette conférence a été bien démontré par Julien et par Dr Nicaise, être préparés pour de prochaines pandémies. Le monde a montré qu'il faut avoir des secteurs de santé résilients qui sont capables de continuer à donner les soins habituels tout en faisant une réponse appropriée à n'importe quel danger, que ce soit une pandémie ou autre chose. Et il y a d'autres dangers qui arrivent, ce n'est pas le dernier. Donc j'exprime ma gratitude à l'Union africaine qui, à travers le CDC, organise cette conférence, et au gouvernement rwandais qui, à travers le ministère de la Santé, co-organise, co-host, co-own cette conférence. L'anglais et le français, on le mélange. Hein. Heureusement que je ne parle pas arabe et d'autres langues africaines, sinon tout serait un beau pot. Ce que l'Africa CDC a fait et le gouvernement du Rwanda a fait nous a aidés à contenir cette pandémie et nous permet d'être ensemble ici et permet de concevoir une conférence qui sera mixte avec beaucoup de participants en personne dans ces locaux et aussi beaucoup de participants virtuels. La première conférence, je vous ai dit, a été un succès, mais la conférence qui vient sera encore un plus grand succès parce que nous avons le temps de la préparer, nous avons le temps de le faire en sorte que ce soit une conférence qui soit engageante et une conférence qui réellement stimule les innovations, stimule le partage des connaissances et stimule la recherche de solutions qui sont adaptées à notre contexte, chacun selon ses pays. Nous aurons des experts de toute l'Afrique qui viendront ici à Kigali partager ce qu'ils ont fait. Et ça sera la deuxième conférence et ça sera sûrement un succès. J'appelle déjà toute l'Afrique scientifique, toute l'Afrique des secteurs santé à préparer à venir à Kigali en décembre de cette année. Merci beaucoup à tous.
Merci à vous, Professeur Vinagwaho. Yes, let's not be shy. Let's give her another round of applause. Et merci d'avoir communiqué l'idée en général de la conférence, qui est en soit les solutions africaines à des problèmes africains. J'aimerais également faire remarquer la présence du professeur Muvunyi Mambo Claude, qui est directeur général du Centre biomédical du Rwanda. Vous êtes les bienvenus. Abanena nasabwe kuvanga indimi mvuga n'ikinyarwanda kugira ngo nsobanurire abateraniye muri iyi nama ndetse n'abadukurikiye ku ikoranabuhanga ko iyi ari inama yiga ku bijyanye n'ubuzima rusange izateranira mu Rwanda ku itariki ya 13 kugeza ku 15 ukwezi k'Ukuboza uyu mwaka, ikazitabirwa n'abashakashatsi, ikazitabirwa n'abakora za politiki zitandukanye zigamije kunoza no guteza imbere ubuzima rusange bw'Abanyafurika. U Rwanda rukaba rugiye kuyakira ubwo izabiba ku nshuro yayo ya kabiri, kandi mukaba mutumiwe mwese icyo gihe. Uyu munsi igikorwa kiri kuba ni icyo kuyitangaza no kumenyekanisha ko izaba. Then I would give the floor to Professor Senait. I have already shared her bio. The floor is yours, Professor.
Thank you. Thank you very much, moderator. Can you hear me? Good morning, everyone. Excellencies, members of the African Union, ACDC teams, members of the organizing committee, invited guests, and members of the press. I also would like to say welcome to Kigali, to all of you, for those of you who've come from out of town. I have the distinct honor of calling this beautiful land my home. So welcome, Murakaze neza. It is an enormous pleasure and honor to be here today to the launch of the second annual conference, International Conference on Public Health in Africa. Here is to many more of this and creating more of a continental platform. And to the leadership of Africa CDC, I want to say thank you for making this incredible platform possible, and to all of you in the room. My co-chair, Prof. Agnes Benagao, and I know that this platform is evidence of what we can collectively achieve when we put our minds to it and decide to make space where none existed before. The pandemic, while it has caused deep pain, globe, that disruption has brought light to Africa's potential to not only build its own institutions, but also provide valuable input and, frankly, hold to account the current global health priorities and practices. We have learned that the status quo of global health systems cannot continue as it is now. It is time for change, and this is the start of a sustainable continental shift. It's not going to be just holding conferences. We need to focus on building our continental institutions, capacities, capabilities, and this will be then the platform that will bring our researchers, our innovators, our discoverers to share their data, their learnings, their experiences, and also opportunity for networking. The past couple of years have also shown us that whenever our national and regional systems are strained, the most impacted of society will always be, and most of the time will be, marginalized communities, including women and girls. That should inspire us to work even harder and design bolder African solutions centering the most marginalized in order to improve healthcare for all. To design forward-looking and equitable systems, we need to create platforms and institutions that foster collaboration and allow for active participation of young experts and professionals. So this conference is an incredible opportunity to bring together the best and brightest of the continent. And I must emphasize that we have immense talent and human capacity in Africa. So we are creating the platform for them. And that will allow us to forge partnerships on research, innovation, and shape creative solutions to our challenges. I'm still in awe of what has been achieved through the inaugural conference, although it was virtual. The depth of conversations, the talent in each of the panels, the commitments from our esteemed heads of states, and much more. Above all, it has changed how the world perceives what Africa and Africans can do in the global health space. So under the leadership of Africa CDC, and was co-hosting with the government of Rwanda, and everyone involved in bringing this next conference together, I'm certain that we will help unleash the potential of this platform to advance our continent's health system, ensure access to quality health services for all that is based on science, evidence, and data. Thank you all for being here, and we look forward for working with you. I also really would like to thank the local organizing committee for spearheading this effort. Of course, we do have an international scientific committee, but a lot of the weight is going to be on you, and we are there to support every step of the way. So thank you very much. Murakoze Chane.
The pleasure is ours, Professor Sinait Viseha. Now, our next speaker is the Deputy Director of Africa CDC, Dr. Ahmed Ouma, who currently serves as the first Deputy Director at the Africa Center of Disease Control and Prevention, Africa CDC, and a specialized agency of the African Union. And in this capacity, he works closely with the governments and other partners to safeguard the health and the well-being of African nations. Dr. Ouma, the floor is yours. Thank you.
First, let me bring the greetings and apologies of Dr. John Denison, the Director of Africa CDC, who, due to
Thank you so much, Dr. Uma, for your remarks, for your keynote address. Allow me now to acknowledge our funders for the CPHIA 2021, who are represented in the room. Susan Thompson Buffett Foundation. We recognize also the African Union Commission, representative of Africa CDC, the government of Rwanda, who is a key partner, and Rwanda Biomedical Center. Now, our next keynote address deliverer currently serves the people of Rwanda as the Minister of Health since February 2020, where he leads the development and execution of health sector plan. Prior to these responsibilities, he worked as WHO consultant, providing technical assistance to the same ministry he's now leading on the development of malaria and neglected tropical diseases, strategies, guidelines, norms, and standards. He was supporting and assisting to define program implementation, modalities, and providing assistance to conduct periodical programs reviews and resource mobilization. Ladies and gentlemen, let's join our hands for Dr. Ngamije, Minister of Health. The floor is yours. Thank you.
Dr. Ahmed, Africa CDC Deputy Director, representing the Director, Dr. John Kengasong, co-chairs, Professor Agnes Binagwaho and Professor Senait, senior government officials, members of media, distinguished ladies and gentlemen, good morning or good afternoon, depending where you are watching this event. I'm very pleased to participate at this important event for the launch of the second International Conference on Public Health in Africa, one of the largest public health events. The unprecedented COVID-19 pandemic has shown the vulnerability and the fragility of our health systems unless we continue to invest in research and innovation to be better prepared. Rwanda is driving research and innovation for health system, strengthening by establishing various bodies that complement each other and contribute to improving Rwandans' health research, including the Rwanda Food and Drug Authority, Rwanda Biomedical Center, Rwanda National Ethics Committees, and among others. The theme of this year's conference, Preparedness for Future Pandemics, Africa at Crossroads, which is appropriate given Africa's socio-cultural, economic, political, and structural challenges during the pandemic era. This calls for the long-term investment in research and health facility infrastructures, academics, strategic collaboration and partnership, among others, for building resilient health systems that not only deal with emergency and pandemics, but also ensure continuity of essential health services and operational research to inform decision makers on public health matters. The second International Conference on Public Health in Africa that we are launching today is a unique platform that brings together African researchers, policymakers, and stakeholders to share their perspectives and research findings in public health while entering in the new era of increasing scientific collaboration and innovation across the continent. Africa needs to actively contribute in defining new public health order. I take this opportunity to commend Africa CDC, the co-chairs of the conference, and the entire scientific committee and organizing teams in planning this event, and would like to express the government of Rwanda full commitment and dedication in taking the necessary preparation measures to ensure successful CPHIA events. We expect achievement of outcomes regarding advancing science on the continent, which is in the line with the Africa We Want agenda, stating that by 2063, we should be a continent whose development is driven by its people and based on the potential of the African people. Distinguished participants present here and those attending virtually, to conclude, it's my great pleasure to officially launch the second International Conference on Public Health in Africa, to be hosted in Kigali from 12th to 15th December 2022, and we will be honored to welcome you. COVID-19 reminded us that investing in a resilient health system is investing in sustainable security of our countries. I wish to thank you very much and wish all of you fruitful deliberation today. I thank you so much.
Thank you so much, Honorable Minister, for your remarks. At this time, I would kindly invite you to have a group photo before we proceed with the media brief. I will invite all the speakers, Honorable Minister, our esteemed co-chairs, Professor Binagwaho and Professor Senait, our Chair of Local Organizing Committee, Ms. Noela, Dr. Nikes, to come forward, DG RBC, Professor Muvunyi, and who is the Chair of our Scientific Committee, Local Scientific Committee. If by any mischance I forget about someone, please remind me. Thank you so much for everything. Maybe I was about to ask that the volume be loud. Now we are going to proceed with the press briefing. Nshuti zacu banyamakuru mudufasha kumenyekanisha amakuru ku banyarwanda no ku baturarwanda. Twagira ngo tubamenyeshe ko uyu mwanya ari umwanya tugiye kubaharira, ubwo dusaba bagenzi bacu ku settinga pano. Kuri pano 4 chairs. Kuri pano haraza kuba hari Professor Binagwaho and Professor Senait na Noera Bigirimana ndetse na Dr. Nikez from Africa CDC. And as they will be coming up, Honorable Minister, tuzi ko mufite n'izindi nshingano zibahamagara, turaza kubemerera igihe mubishoborera muze kuba mwadusezerera nta kibazo. So it's my utmost pleasure to invite, once the setting is done, Professor Binagwaho, Professor Senai,
Hello? Yego. Nitwa Juventine Munagije Maria, nkorera TVTN Radio 10. Ikibazo cyanjye ndakibaza mu Kinyarwanda. Ndashaka kubaza murimo murarwanda nuko Afrika haba ibisubizo bijyanye n'ibibazo bihari mu bijyanye n'ubuvuzi. Ariko turacyabona abantu biga ibijyanye n'ubuganga bakabiminuzamo ariko bakajya kwikorera hanze y'igihugu. Hari icyo muteganya ku buryo baza akaba ari bo banagira uruhare muri ubwo buvuzi bukorewe mu Rwanda no muri Afrika muri rusange? Murakoze.
We can take one more question. New Times.
Good morning. My name is Alice from New Times. I have two questions. One goes with, there are some new developments around since following the establishment of the Africa Medicine Agency. Since many officials have claimed, made calls on the efforts to be made in investments and backing it up, I would like to know if there are new developments around that area. And my second question goes like, the pandemic in different countries are sort of diverted efforts from other health issues, and we have seen that in many countries, as the report from the OMS or the WHO says. So I'd like to know, in Rwanda, how have we dealt with that? And what's the way forward in that aspect? Thank you.
We have also another question from online. It was addressed to Dr. Uma. I would kindly divert it to Dr. Nikes. It says, we have heard about the ongoing nasal COVID-19 vaccine clinical trial. If it is given a green light, will African countries access the vaccine? And the second question goes like, what was the main success recorded in the field of the first CPHIA? Now let's proceed to the replying of the questions. Ikibazo cya mbere cyabajijwe na Juventine Muragije Maria wo muri radio na TV 10 kijyanye n'abiga umwuga w'ubuvuzi aho kugira ngo bagaruke mu bihugu byacu bya Afurika bafashe guteza imbere public health, ahubwo bakajya mu bindi bihugu basa n'abakurikiye imishahara cyangwa se ubundi buzima bwiza kurusha ubwa hano. Noella, I don't know if you want to take that in Kinyarwanda. Thank you.
I can complement this by saying that at African Union level, there is also a reflection on health workforce, two types. Those who give services, the clinician, and those who are not giving services, but are creating equipment, drugs, vaccine. And this commission is helping countries to raise money to secure the workforce. However, it's a true problem that we should even tackle legally. You know how costly it is to educate a nurse, a lab technician, and a doctor. From primary school up to the degree. And after that, those people in who the country have invested a lot, and families go and work outside. In 2017, it has cost the developing world $2 billion. Because the rich countries are receiving full Finnish educated young people for free. So there is an international hypocrisy, there is an international lie that we should tackle legally. Do you know that for a footballer, for example, if we educate a footballer to take the footballer to another country or another team, you have to pay the country or the team. For doctors, nurse, lab technician, etc., no, you just steal them. So there is a reflection to have there. You are right.
murakoze iyo mibare nshobora kuba ntayifite aka kanya ariko twayishaka tukayibaha. Yarabajije ikibazo cyo kureba niba hari imibare dufite y'abaganga cyangwa abaforomo cyangwa se n'abandi ba health professional bakorera hanze y'umugabane. Iyo mibare immediate ntayo mfite, ariko icyo turi kwibandaho cyane cyane muri level ya ministere n'ibigo biyishamikiyeho nuko abo bari kugaruka mu maprograme menshi. Hariyo navuze ya HRH, ariko hari n'indi igiye gutangira muri uwo murumva ya vaccine manufacturing n'iyindi. Izo programme zihari, ubwo ibyo Dr. Binagwaho yavuze yari ku rwego rwa African Union, ku rwego rw'u Rwanda naho tudafite iyo mibare immediately right now, ariko icyo nababwira nuko aya maprogramme ari kwibanda kuri abo bari hanze, bakaza bagafasha muri izo natanze example cyangwa se ingero ebyiri z'amaprogramme, ariko hari n'ayandi menshi mu rwego rw'ubuzima ariko no mu zindi sectors zo mu gihugu. Ariko icyo kibazo nk'uko mukivuze ni ikibazo gikomeye.
And I can give an example we do at the University of Global Health Security. Young people from Rwanda and the region can be educated as doctors for free. But they have to sign that they will work for the Ministry of Health 9 years for the full salary, so that they are well paid where the ministry need them. And if not, they will have to reimburse their education. So there are things like that that are coming across the continent that will help to secure workforce for serving the Africans.
Thank you so much. The other question was addressed to Dr. Nikes about the nasal COVID-19 vaccine clinical trial and how African countries are going to have access to this vaccine once it is given a green light. The floor is yours.
No, thanks so much. That's a very interesting question. And for sure, really, in general, that's going to be an addition to the panel of vaccines that we have in our pipelines, and definitely will contribute to bridge that inequity and, again, have access to the vaccines for the continent. But before we get there, there are processes, okay? So, and we definitely have that within the African Union. There was a question around the AMA, so that's exactly what AMA, the African Medicine Agency, AMRH, within the AU, are taxed for. So what exactly going to happen? If they're still at the clinical trials level, it's not the end product. It's okay. There are different phases before we get to that product, really administer the product at least to the 1.3 billion people we have on the continent. What I can say there is that it has to show some level of efficacy. We have to see efficacy data. We need to see the really cost. We need to see stability data. That's what goes into the package after the clinical trial. I'm making sure that I explain the entire process. That's going to be a game changer for sure for those that are afraid of needles. So we need to see that data. We haven't seen that yet. But we strongly encourage from the African Union, during the course of a pandemic, a reliance process. We don't have to reopen files, study those ones. We usually take 8 to 12 months for reviews. Usually what we do, there's a pathway within the AU, a regulatory pathway. First, if the vaccines, now I'm referring to the end product here, not the product within, still under a clinical trial. If the vaccines actually have received emergency use authorization, or is on the WHO emergency use listing, we usually approve. We take that because it has gone through a thorough process. The second, if a stringent regulatory authority, US FDA, EMA, UK MRHA, they have approved it, and then the regulators at country level, because we have to really be sure that countries, the regulators are empowered. At the country level, if they approve it, we can tick that box. But the third one, where it's usually problematic, you don't have any, like US FDA, you don't have WHO, EUA, we're very cautious. We're very careful recommending those vaccines until we have enough evidence in terms of efficacy, in terms of effectiveness as well, because we've seen that during the course of this pandemic. So all these actually to protect you, us, and be sure that the vaccines that are being deployed are safe enough for the continent. I think we are moving there to strengthen capacity of our regulators to be able to do that. And you recall we all had a meeting here last year, and one of the key elements actually was around strengthening capacity of our regulators. How do we bring all the regulators to be able to make those decisions across the continent? I'm pleased to say that it was actually funded through the Susan Buffett Foundation. That meeting, we're yet really to bring all those regulators. Only 4 across the continent that have achieved maturity level 3 to be able to make that decision equal to the US FDA. I can name them. There's Ghana, Tanzania, now Nigeria and Egypt. And you see we're 55 countries. So we need to build or strengthen their capacity to be able to make that decision, and also build capacity of AMA and AMRH to be able to respond. I think we're on the right path here. But in a nutshell, we need to see data. The regulators have to look at it, review it, endorse it at country level. Then AMA is going to again put a stamp of approval for the rest of the continent. So that's my short answer to that, but I'm happy to take any further question for clarification. Thank you. Over.
Thank you, Dr. Nikes. The next question, I would like to address it to our co-chairs, Professor Senait, and Professor Binagwaho. It goes like, what was the main successes recorded in the field of public health from the first conference on public health in Africa, CPHIA 2021? Let's start with Professor Senait. Thank you.
Thank you very much. Very good question. So as we said, the conference is a platform to bring African scientists, ministers of health, government officials, policy folks together, right? So what we did at the first meeting was we had 12,000, unprecedented, large, it's probably one of the largest public health conference that has taken place. And in that meeting, we had various tracts, but the main takeaways that we came out with, for example, was the actual solidarity around for a need for a new public health order for Africa, right? So historically, this continent, I think it was the deputy chairperson of AU talked about, this is the only continent in the world whose needs and priorities are outsourced for international agencies. You know, Europe decides its own path, whether it is approving medications, diagnostics, therapeutics, the Americas, everybody does that except Africa, where we go to OMS to approve our drugs. So what we came out of that was absolutely the need, what we've learned in this pandemic, when push comes to shove, that we get left alone, which means we need to start standing on our feet, you know, strengthen our capacities, our capabilities, building our own institutions. But we were also able to bring global partners, right? So the resolve from all the pharma company CEOs to support vaccine manufacturing in Africa. The resolve to strengthen our workforce. You have heard HRH and so many others. We were also able to share what were the best practices. How did Rwanda manage to keep COVID? You know, although the early assessments of emergency preparedness ranked Africa at the bottom and Europe and North America on top, what happened with this pandemic was the opposite. And that was not sheer chance. That was not just a coincidence. It is because African countries continually face challenges and are better prepared in emergency detection, response, timely response. So what were the lessons in countries that managed the pandemic quite well? So there was also a huge platform to bring African scientists and researchers and policymakers together to share best practices, to share research, to create networks. So there is a paper that came out that I think we can avail to you after this for those who are interested who ask the question, that can actually show you what were the tangible outcomes.
The conference and all the abstracts have been published.
Esteemed co-chairs, and I'm very mindful of the time and know you are expected in another meeting. If you allow me to release you for that meeting and address the next question to Noella before we conclude this. Professor Senaid, Professor Binagwa, you're free to leave for the next meeting. Thank you so much. The next question is from Liska Gina from the New Times. I would like to address it to you, Noella Bigirimana. He said, are there some new developments around the Africa Medicine Agency since its establishment? If you, both of you have something to say about, in reply to that question, the floor is yours. Thank you.
So I think we can take it.
Yes, Dr. Nikes.
I guess I don't have an alternative. But I would say that before the co-chairs and Dr. Nikes left, so I guess we can apologize because the next session is already starting. That's why the panelists had to go. But maybe quickly to answer Alice's question, part of that answer was provided by Dr. Nikes because, as you know, the AMA came into force towards the end of last year. So since it's been a focus on strengthening not only national level regulatory agencies, but it's also about operationalizing AMA. And as you know, the mandate is growing notably with the new capacity and capabilities, such as we've mentioned manufacturing of vaccines, but it's really biomanufacturing. So maybe I'll refer back to what Dr. Nikes had already explained. There was a second question, I think, that was not captured around sort of basically what we're observing as perhaps a risk of diverting efforts and resources while the pandemic is still ongoing. I hope that's what I was able to capture. So at that level, it's really so. Again, there's a reason we are wearing masks, right? There are variants that are still quite prominent, and sub-variants, as we are seeing, sub-variants of Omicron that continue to really show high transmissibility, right? So in the midst of a pandemic, there is a risk that we've seen that resources are being deployed, but it really takes us back to what the core of this conference will be able to reflect, because we shouldn't see the COVID-19 preparedness and response at this level. It's response and preparedness for a potential next crisis. We shouldn't necessarily see it as something that's standalone, that is not really anchored into the public health system and the health system of a country. Actually, it should be part of it. Because as you are responding to COVID-19, the country has, and the system has to also be responding to other diseases. Unless, and when we don't pay attention, what we are seeing is an increase in mortality due to the other diseases. So to your point about some of the countries that are diverting some of the resources, perhaps that's something that needs to be looked at much closer, because when you divert resources to a pandemic that's ongoing, and maybe enough resources to begin with were not put in place to continue providing services that are addressing other diseases, that also contributes to the risk, not only in terms of mortality and morbidity of the pandemic, but for other diseases. In the country, if I speak for Rwanda, you will see that the response has taken a different turn. And it wasn't necessarily through diverting the resources, but it was rather through, I would say, plugging the COVID-19 response at the across the system. And so you'll see that the testing that used to be centralized is now decentralized. You see that the vaccination campaigns are across the countries, are ongoing at various health facilities, right? You're seeing less and less of the mass vaccination campaigns, although we may go back to that as we continue to try to answer that from a perspective of Rwanda. But again, the COVID pandemic response is ongoing. So that also has to go with the appropriate resources. So I'll pause here maybe and turn back to you.
Thank you so much, Noela, and thank you so much for having accepted to stay alone on the panel. Now, niba mubitwemereye twasoreza ahangaha, wenda baza kuba bafite ibindi bibazo tukaza gushaka uburyo dukora interview ku ruhande, ariko twagira ngo tubashimire Deputy Director General wa RBC, ukaba uri na chair wa Local Organizing Committee ya CPHIA, Conference on Public Health in Africa. Namwe mwese rero mwitabira iki kiganiro turabashimye, mugire umunsi mwiza, murakoze.
Nashaka no gushimira aba members ba Local Organizing Committee, hari abo tutarecognizing they are in the room, as well as the scientific community, the scientific committee.
Thank you.
you.